On the last video, we talked about general causes of low back pain, and this time I'm going to look a little bit more detail at another specific cause of low back pain, and that is symptoms that come from what are called the facet joints. The facet joints are pairs of joints that are located in each region of the spine, in the cervical spine and the thoracic spine, and in our case today, as we're talking about the low back region or the lumbar spine, these facet joints are located one on either side of the central part of the vertebrae. They're described really mechanically as functioning like guide rails, or some people describe the anatomy as like a three-legged stool, where the front part of the vertebrae, which is the large cylindrical structure, that's the main weight-bearing column, and each vertebrae has a disc in between it, which acts like a shock absorber. So about 80% of our body weight goes down through this front column. And then these little facet joints at the back on the sides are a bit like stabilizers on a bicycle, or as I say, like two other legs of a three-legged stool. They help to stabilize, but they're mainly, they don't take a lot of weight in the normal course of events. They're just there to control movement. The facet joint is different shapes in different parts of the spine, but essentially they're little flat plates, if you like, and each vertebrae forms part of the facet joint, and its job in life is to slide and roll as the vertebrae move in our back with movement. So, as with all kinds of pathology, there's a fairly wide spectrum of severity, from low-grade strains to recurrent irritations at one end of the scale, to degenerative change and thickening of the tissues and wearing of the cartilage on the joint surfaces at the other end of the scale. So from a clinical point of view, we're always trying to identify, well, where is somebody on that scale? What's the degree of reversibility of the problem? And obviously from a rehabilitation point of view, our real challenge is to try to identify, well, what are the causative factors that are making the facet joint sore? And sometimes it can be unilateral, that is one on one side, or sometimes you can get facet joints irritation at the same time on both sides. One of the commonest causes of facet joint overload and irritation is when the disc space begins to narrow. Now, that could be as a consequence of a disc prolapse, as in a bulging of a disc, and usually the bulging of the disc is the most dominant symptom, particularly if that bulging is putting pressure on a nerve. But one of the effects of the disc squeezing out and bulging or protruding or slipping, as is sometimes referred to, is that it often narrows the height of the disc, so it becomes a bit more squashed and compressed. And when that happens, a bit more pressure goes onto these two little facet joints on the side. And if it happens asymmetrically, it'll load a joint on one side. So that can happen as a consequence of bulging. It can happen just if the disc space gradually narrows over time, which it tends to do anyway. That's a natural part of the aging process. And disc space narrowing by itself isn't necessarily a painful phenomenon. But one of the consequences of that can be then to put more pressure on the facet joints, which then starts to irritate them. And it can be either, as I say, one-sided or on both sides at the same time. One of the hallmarks of facet joint pain is usually people will point very specifically to where it's sore, and the facet joints are located about an inch off to the side of the midline of your back, the central bony bit of your spinal column. The facet joint is located about an inch off to the side. So usually when people have facet joint pain, they can pinpoint it very specifically and say, yeah, there's my pain, and this is the movement that brings it on. It's often confused with muscle pain because there are a couple of inches of muscle that sit on top of the facet joint, and usually if the facet joint is irritated, the muscles will be in spasm over the top of it, so the muscles may feel sore and tense. But usually the hallmark of the facet joint irritation is that it's sharp, specific pinpoint pain, aggravated by certain positions and eased by changes of position. So it's a pretty straightforward kind of a condition to diagnose. And then the clinical challenge is to identify where on the scale you are and how can one go about trying to identify causative factors and correct them if possible. You can't do much about disc space narrowing, so that's certainly one option where there isn't change. But very often one of the consequences of disc space narrowing is to make the movement between each vertebra become stiff. I often describe it to people as like rusty links in a bicycle chain, and very often with graded manual therapy you can stretch and move and regain mobility in the tissues, and that helps to disperse the pressure and try to reduce the sensitivity. And that's a pretty straightforward process, and one usually knows pretty quickly if that's helping to unload the tissues. So that's one type of treatment option, which involves manipulation or mobilization and specific stretches to target the area. Other causes of facet joint pain can be differences in leg length. So people have, if they have an asymmetry, then differences in leg length cause the pelvic position to tilt or angulate, and that will tend to put more pressure up on one side of the facet joint. So clinically we have to identify, is that what we call a true leg length difference? Is there a reason why one leg is longer than the other? Sometimes an old fracture or damage to a growth plate or something very significant in history, and if a leg is physically longer than the other, or one is shorter than the other, whichever the case may be, sometimes there's no option but to try to level the legs off with a view to trying to level the pelvis, if you like, the foundation of the spine, so that the weight is more even on the facet joints. More commonly than not, people will have an apparent leg length difference, and that's not actually a structural difference between one leg. It's because the position or angulation of the pelvic joints and the sacrum have become asymmetrical because of how the muscles are working in the area, or if some muscles have become excessively tight and overactive and other muscles have become inhibited. People just slowly adapt over time and get into positions which are asymmetrical, and that ends up putting pressure on the facet joint. So that's quite important to identify clinically, because those people with an apparent leg length difference do not require inserts into shoes. They require essentially a rehabilitation program that tries to level the pelvis up, maintain the position of the pelvic joints and the leg joints. That will often involve strengthening of the core musculature, of the hip musculature, of the legs. So it needs an integrated kind of management plan in order to try to dissipate the pressure. Obviously, if people are on the more severe end of the scale, where they've had recurrent episodes, and maybe not an uncommon scenario is that they've had an acute episode of the disc prolapse with sciatica, and the sciatica has resolved, so the pressure of the disc bulging on the nerve has resolved, but the secondary effects then have been to leave the facet joints more loaded. And if that progresses over time, those facet joints can become thicker. So we get extra bone formation around the facet joint. That rarely happens in isolation. It usually happens as part of a more generalized degenerative process, and people tend to find the spine just feels stiff and awkward and uncomfortable to move. And so it's generally part of a more widespread kind of a feature. And you can get irritation of the nerve, not just from the disc bulging, but from thickening around the facet joint. But again, that's really almost exclusively in people who have very widespread degenerative changes. Whether those kind of conditions can be managed conservatively, again, it's always worth trying to identify, can you regain some movement in the joints if they are stiff on examination? And if that is the case, then they're certainly valid targets to try to mobilize. And you'll usually know within 3 or 4 treatments of manipulation and stretching and corrective exercise whether it's helping to unload the symptoms and reduce the severity. If you don't see a change in that sort of time course, then the next option for treatment is facet joint injections. So these are done by pain specialists or invasive radiologists who will use image-guided injections, which are pain-killing injections and anti-inflammatory injections, which often aren't cures, but they're a way of easing symptoms. And I would have plenty of patients who might have facet joint injections once a year, and it tends to keep them going. If you're in the situation where the facet joint has got very, very thickened and the thickening is pressing on the nerve, then really there is no option but to have a surgical debridement. But that really just takes the pressure off the nerve. It doesn't really restore the mechanics of the facet joint. But again, people in that category usually have fairly limited back function, and there's a limit to what can be achieved there. But that's very much the small end of the spectrum. The vast majority of folks can be managed with combinations of physical treatments and stretching and muscle strengthening to try to redistribute the pressure. So that's the next structure on the list of general causes of low back pain, the facet joints. The next video through, we'll delve into a bit more detail on some of the other structures that can cause low back pain. I'll see you again in another video. Bye for now.